Hey everyone, thank you so much for joining our webinar today. Thank you so much for joining our national call. We will get started in exactly 1 minute. So, as you are waiting for us to get started in 1 minute, feel free to amplify the fact that you are on today's national call. Amplify this on your social media, whether you are on Twitter, Blue Sky, or Instagram, Facebook. Use that hashtag BMHW25. Let the world know we are gearing up and we are still excited and we are still going to hold on to our joy and justice, right, for our communities, because we are here to continue to promote, Black maternal health equity in our communities. So use that hashtag all across social media. We want the world to know that we are not backing down. We'll get started in a few seconds. Thank you all so much for joining us today.
Good afternoon, and welcome to our official national call about the 2025 Black Maternal Health Week campaign that takes place annually April 11th through 17th. I am Asia Caldwell, the Digital Media and Development Associate here at BMMA. The aim of today's national call is to just share some key information about the purpose of the campaign and where to find more information on how you can support and participate this year. The theme for this year is Healing Legacies, strengthening Black maternal health through collective action and advocacy. We'll share some of the activities we have planned so far and provide some guidance on how you can engage with us throughout the week, both with BMMA directly and in your own communities. So before we begin, a quick note. Closed captioning is available. To enable it, click on the closed captioning button at the bottom of your screen. If you don't see it, click more to find the option. Now I will pass it over to our initiatives coordinator, Dakema.
Thank you, Asia, for that introduction. BMMA would like to thank everyone for joining us today to learn more about Black Maternal Health Week 2025. We deeply appreciate your interest, support, and commitment to improving and advancing maternal health for Black mamas, birthing people, and their communities. As the founding organization of Black Maternal Health Week, the Black Moms Matter Alliance, or BMMA Incorporated, is proud to witness how this movement has grown over the past 8 years. With your continued involvement and support, we know it'll only expand further. During today's session, we will cover the BMHW 25 theme, key events, sponsorship and merchant opportunities, ways to get involved, and a sneak peek at partner activities. We'll also share how you can stay informed about local events and opportunities to engage throughout the week. BMMA is a national network of Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. Our alliance includes a diverse range of professionals from midwives and OBGYNs, nurses, doulas, lawyers, academics, artists, and public health researchers. Our mission is to center Black mamas to advocate, drive research, build power, and shift culture for Black maternal health, rights, and justice. BMA's focus is to build the skills, convene, and mobilize the global Black perinatal, maternal, and reproductive health workforce as a means to end maternal mortality. We do this work through the following bucket areas. We work to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes. We cultivate research that leverages community knowledge and Black scholarship. We advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches for everyone's care. And we shift culture by dismantling negative narratives on Black motherhood and amplify the voices and experiences of Black mamas. Centering the ingenuity of Black-led maternal equity initiatives across the country and globally that are making a difference is imperative. This is the primary function of Black Maternal Health Week. Of particular note, we use the phrase Black mamas to include a range of birthing people. cis women, trans folks, and gender nonconforming individuals that are of African descent across the diaspora, to those who care for and mother our families and our communities, whether they have given birth or not. We stand in solidarity with all Black mamas. Now, I'll pass it back to Asia to dive into all things Black Maternal Health Week.
Thank you, Dakema. So, founded in 2018 by BMMA, Black Maternal Health Week intentionally takes place in April, which is recognized in the US as National Minority Health Month. Additionally, we begin Black Maternal Health Week on April 11th annually to join dozens of global organizations in marking this day as International Day of Maternal Health and Rights, an opportunity to advocate for the elimination of maternal mortality globally. So for BMMA, we recognize maternal mortality as a global crisis that affects Black women, not only here in the United States, but across the world. The purpose of the campaign is to deepen the conversation about Black maternal health so that public stakeholders understand how root causes like systemic racism act as drivers of maternal health inequities. The campaign will, and we want to drive this point home, center the voices, scholarship, work, and experiences of Black mamas, Black birthing people, and their communities. A primary goal of the campaign is to amplify the policy, research, and care solutions that are being harnessed in our communities. The campaign will also inform policymakers and community leaders on policy solutions and will showcase to the general public the power of organizing and the importance and necessity of maintaining space for Black leadership in this work. And we are excited that this is our 8th anniversary of Black Maternal Health Week. I want to take this time to thank all of our sponsors and alliance partners for an outstanding and impactful 2024 campaign. Through the collective efforts of Black perinatal, maternal, and reproductive health care professionals across our network, we hosted over 60 events nationwide, engaged more than 2,300 registrants across 3 webinar series, and welcomed over 800 participants in our annual Black Maternal Health Walk and Block Party in Atlanta last year. More details on the impact of the 2024 campaign can be found in our year-end impact report on the homepage of our website at blackmamasmatter.org. Passing it over now to BMMA's co-founding executive director, Angela, to describe this year's theme.
Thank you, Asia. Each year's Black Maternal Health Week theme is carefully chosen by BMMA's alliance partners to ensure that it is sufficiently capturing the ethos and spirit behind our collective efforts to amplify the voices, perspectives, and lived experiences of Black women and birthing people. The official theme this year is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. This year's theme emphasizes the power of Black-led perinatal, maternal, and reproductive health organizations to drive systemic change and foster community healing. The theme acknowledges the persistent legacies of systemic oppressions, reproductive injustices, and health inequities that have disproportionately affected Black mama and people. It emphasizes the need for healing at both the individual and community levels while addressing the importance of restorative approaches to maternal health care. BMHW25 celebrates the leadership and expertise of Black community-based organizations as the foundation for advancing equity and ensuring transformative, sustainable improvements in Black maternal health. Advancing collective action highlights the essential role of collaboration between Black-led organizations, advocates, and communities to lead advocacy efforts, shape policies, and amplify solutions. This week underscores the necessity of unity and the power of community to create a future where Black mamas, families, and communities thrive. The events and programs planned for Black Maternal Health Week 25 We'll fully embody this theme and offer opportunities to engage in activities and conversations that honor the values and traditions of the reproductive and birth justice movements. Now, I want to take some time to extend my warm greetings to all of you, our dedicated public health leaders, especially at the federal level and at the state levels, our researchers in academia, all over and in our communities, our policymakers, our healthcare providers, everyone, all of our civic servants working every day to protect our nation's health at all levels of government. And I genuinely mean this from the bottom of my heart as also a former civil servant as well. Today, I stand in deep gratitude for the work you have done and continue to do in advancing maternal and infant health equity across the US and even globally. Over the last 5 to 10 years, your commitment to research, epidemiology, policy, and programs has saved lives. You have fought to improve how we collect and use maternal health data, ensuring that not only do we name the crisis, but we take decisive action to end it. Because of you, we are not just tracking maternal deaths, we are holding systems accountable to ensure that data leads to solutions, to training, to resources, and to quality care for those who need it most. We've even seen states strengthen their maternal mortality review committees, their MMRCs, to improve maternal death surveillance, helping us understand the preventable causes, right? Because we know that this is 80% preventable, the preventable causes of maternal mortality, and identify real solutions. Your work has led to the development of strategies for sustaining maternal and health services in times of crisis, including during natural disasters and public health emergencies, ensuring that birthing people are not left without critical care in the face of hurricanes, wildfires, and pandemics. Your research continues to build evidence that addressing mistreatment and biases in maternity care improves health outcomes. From listening to the experiences of Black birthing people to implementing bias training and accountability measures, we know that respectful, quality care must be the standard, not the exception. Your leadership ensures that no one is left behind, that our nation prioritizes the well-being of Black mothers and birthing people, and that we continue to push forward with evidence-based, culturally responsive solutions. We need you now more than ever. In a time where misinformation spreads faster than truth and where dangerous infectious diseases continue to rise, your work is critical in protecting our communities. Now is not the time to back down, and that's for everyone on this call and beyond. Now is not the time to back down. Now is the time to double down, to triple down, to continue strengthening public health systems to ensure that policies reflect the needs of those of us most impacted, and to make sure that quality of care provided is equitable, respectful, and centered on human dignity. As we move forward in this fight, I want you to know that BMMA sees you, we value you, and stand in partnership with you. Let's continue to push together. Let's continue to lead with data, with truth, and with an unwavering commitment to saving lives. Thank you for your dedication, your courage, and your belief in a future where maternal health justice is not just a goal, it is a reality. This Black Maternal Health Week is about collective action and community engagement. This movement is strengthened when we show up, when we build connections and amplify the work already being done in our communities. There are so many ways to get involved this year, and this is for everybody. And please spread this message far and wide. Support birth and reproductive justice organizations by finding and engaging with those in your area who are already celebrating Black Maternal Health Week. Connect with Black-led organizations by building relationships with your local Black-led or Black women-led perinatal, maternal, or reproductive health groups. Volunteer your time and invest in organizations that are advancing maternal health equity. Your support, whether through time, resources, or funding, helps sustain this work. And finally, use your voice and your platform to amplify this movement by sharing key messages, events, and advocacy actions using hashtag BMHW25 and help spread awareness from using the Black Maternal Health Week 2025 toolkit, which will be available starting today. And of course, stay connected. Follow BMMA, support us at BMMA and our partners, sign up for our e-newsletter, and keep up with what's happening around you. It is not difficult, folks. We got to build community. We've done it before and we will continue to do it now. Build community, invest back into our communities. We can make things happen because we still got work to do for ourselves. All right, now I'm passing it back to you, Dakema.
Thanks, Angela. As we gear up for Black Maternal Health Week 2025, excited to engage in powerful digital activations and community-led events across the country. We're working closely with our partners to bring impactful programming throughout the week. We'll be kicking off Black Maternal Health Week on Friday, April 11th, which marks the International Day for Maternal Health and Rights and Black Doula Day, a time to uplift the essential work of Black doulas and birth workers. Throughout the week, we'll see a range of digital and in-person activations from BMMA and our incredible network of community organizations nationwide. For our Atlanta-based community, we know many of you look forward to the Black Maternal Health Walk and Block Party, and we're thrilled to share that registration will be opening soon, so stay tuned. We'll be sharing more details about how you can engage, including ways to participate in social media activations, volunteering, policy advocacy, and educational events, and how to use our BMHW25 toolkit to amplify key messages. We can't wait to celebrate, mobilize, and advocate with all of you. We urge you to get involved. Black Maternal Health Week is for everyone. Visit blackmamasmatter.org and follow our BMHW25 hashtag to stay up to date on ways you can participate. We'd like to take this time to express our deep gratitude to all of our Black Maternal Health Week sponsors from years past and thank our current sponsors for our 2025 campaign. You can become a sponsor too. We welcome businesses, organizations, and agencies to be official supporters of the Black maternal health rights and justice movement. We are so excited to offer multiple tiers of sponsorship levels in support of this year's campaign. Whether you decide to be an upholder, supporter, advocate, or changemaker, your sponsorship comes with many benefits and will help to sustain our efforts in amplifying Black leadership and care work in addressing maternal health inequities. Fill out the Black Maternal Health Week 2025 sponsorship and merchant form today by going to bit.ly/BMMA sponsor. We will also have volunteer opportunities on a rolling basis. If you're interested, please sign up for our e-newsletter to stay connected. Passing it back to you, Angela.
Thank you so much, Dakema. Now, our network of alliance partners and other Black-led community-based birth and reproductive justice organizations are at the center of why we created the Black Maternal Health Week campaign. Support, collaborate, and engage in local events hosted by our alliance, which can be found on our website. We encourage everyone to check out our local events page to see if an official BMHW25 event is hosted near you. Also, we know that we're not going to be able to capture all the great events happening across the nation for Black Maternal Health Week. That's why I'm encouraging everybody, please use that hashtag, hashtag BMHW25, and we will do our best to share and repost across our social media. You can also stay connected by signing up for our e-newsletter and following us across all our social media accounts. So, we want to give you a sneak peek into the exciting activities and events our partners in our alliance have in store within their respective communities for Black Maternal Health Week 2025. Starting us off is the wonderful Mama Sakisa Berry from the Atlanta Doula Collective. Sakisa.
Greetings, everyone, and thank you, Angela, for having me. Thank you, BMMA. I'm very thrilled to be on the call with you all today. Um, so we're hosting the Black Doula Day Conference, and this is a opportunity to amplify the National Black Doula Day, which is a global Black Doula Day celebration coined in 2022 by Okunsola Amadou from Jamal Birth Village. This is presented by the Georgia Black Doula Network, who is also the Atlanta Doula Collective. We aim to bring together Black doulas, healthcare professionals, and community leaders to discuss the importance of culturally competent care in maternal health, particularly for Black women. This conference provides a platform for networking, for education, and advocacy with an ultimate goal of improving birth outcomes and reducing health disparities in Georgia. So whether you are a seasoned doula or you're new to the field, an aspiring doula, or simply curious about the impact of doulas, this conference, please come out and plan to participate, meet with like minds, help to empower and uplift the Black doula community as a whole. Next slide, please. I also just want to make mention that here in the state of Georgia, we are working together, when I say we, myself and other midwives, to help bring licensure to our state. All of our bordering states have provided pathways to licensure for direct entry midwives. Currently, no pathway to licensure is available in the state of Georgia. And licensed midwives can cover the state provider, the shortage, our provider shortage that we have here, and the closure of some of the rural hospitals, I'm stuttering, the closure of some rural hospitals that leave many Georgia women without care in this state. And so we're asking for any of those constituents and citizens here in the state of Georgia to please reach out to your legislators, your senators, and let them know that you are in support of Health Bill 520. This bill will help to decriminalize midwifery in this state, and it also provides, as you see here, several different pathways into midwifery licensure for this state as well. So I just wanted to amplify those two things that we have going on right now in the state of Georgia, and I'll pass it on to our next speaker. Thank you.
Thank you so much for that, Sakisa. And yes, we're doing really good work here in the state of Georgia. We at BMMA continue to support and follow the leadership of our Black midwives like Sakisa and others who are leading the charge around ensuring that we can get some positive state policies passed to support all of our midwives to practice in the state of Georgia. Thank you so, so very much. Now, we are going to hear from Salima with Oshun Family Center. Salima?
Yes, hey y'all. I just want to say I'm so excited to be here today. Y'all don't see my camera on, but I'm doing a little dance. My name is Salima McNeil. I'm the founder and executive director of Oshun Family Center, which is a nonprofit mental health organization, maternal mental health organization here in Philadelphia. We do a few things to connect with the community. One of them is providing maternal mental health. We also do research because we have a community-based participatory research project with one of our hospitals here in the city. We also work with our youth that are parenting with in the School District of Philadelphia. And we are lead organizers for Black Maternal Health Week here in Philly. So every year we do a whole host of events. We do 7 events in 7 days. Now in this post-COVID era, we are back fully in person. I just want to bring light to the pictures that you see here on the screen. The larger picture is of our maternal wellness village, which has helped since day one. This is our 7th year out of 8 years that Black Maternal Health Week has existed. And those are the power behind all of the events that we do. And then the smaller circle was a wellness event that we did at Bartram Garden here in Philadelphia during 2024 Black Maternal Health Week. Next slide, please. This year, I really just have the spirit of like Kendrick's Super Bowl performance, because I just feel like I want to yell out mustard as we all come together for Black Maternal Health Week. This year, better than any year, we have to show the collective effort. So here's the lineup for our events this year. We have different themes in the theme for Black Maternal Health Week, like restoration for our Cirque and Noir birth worker brunch. We have fully integrated maternal health and arts and culture for this year. So we have a Cirque du Soleil brunch that we've collaborated with the Philadelphia Opera and Bearded Ladies. We are hosting our Carousel of Love community baby shower with our temple partners. We have our Sunday event, which is Wrapped in Love. We also have advocacy action days, Monday and Tuesday. And then we round out with our newest initiative, which is our FADE program, Fathers Actively Devoted Every Day. So when we say muster, M-U-S-T-E-R, let's get together and continue the legacy of Black maternal health, uplifting this community in a way that others do not. So we are committed to this fight. And last but certainly not least, on April 17th, we will have our grand closing mixer that is not listed here because this is a response to Oshun Family Center acquiring their own brick and mortar location. We are under contract and we are journeying to closing on 4/1. So please, if you are in our tri-state area, come out, fellowship with us as we close on this building and really celebrate Black Maternal Health Week. Back to you, Angela. Thank you.
Yes. Thank you, Salima, because guess what? They not like us. They not like us.
They
No.
just not.
Okay.
No.
Okay. That's right. That's
Thank
right. You know, squabble up. Okay, enough of that. Thank you so much, Salima. We are so excited for all the great things y'all are doing out there in Philadelphia with the Shun Family Center, and especially all the activations for Black Maternal Health Week out there. Up next, we have Mama Akunshala Amadu with Jamal Birth Village. Come on, ma'am. I want to hear from you.
Greetings. Thank you so much. Greetings, everyone. I'm following in that energy around Squabble Up because our ancestors are squabbling up right now with us as we get ready for Black Doula Day, y'all. I am so excited. Thank you so much, Angela and BMMA, for just leading us with the Black Maternal Health Week activities. And I want to start off by saying Aburu, Aboye, Aboshishe. For those of you who don't know, that is in our Yoruba language, and that is a greeting that means that may your offering be accepted, may your offering be elevated, may the work manifest. And what that means for us as birth workers is essentially it is saying, may your work always be accepted, may it rise in power, may it manifest beautifully in the world, and may you live long in wisdom. We always say in response, Ogbo Ato, Ogbo meaning may you live long with wisdom. Ato, may your strength and blessings be sustained. So together that means Ogbo Ato to all who stand in their purpose. May you live long in wisdom and strength. So when you see me out in the community, you can say Aburu Aboye, Aboshishe, Okunshola, and then I'll say Ogbo Ato, and we'll keep this work going. So let's get into it. So we're talking about the 2025 global celebration of Black Doula Day. The future is ancestral, reclaiming Black birth and postpartum wisdom. That is our theme for this year. So as we heard prior from Sakisa, she shared that in 2022, I founded Black Doula Day, and it is officially recognized every April 11th. And this was founded through 5 honorable proclamations, and it's now celebrated globally in partnership with Black Mamas Matter Alliance, Jamal Birth Village, and many other Black maternal health organizations across our nation. Black doulas are the keepers of ancestral birth wisdom. And this year's theme around the future is ancestral, reclaiming Black and birth and postpartum wisdom calls us to return to community-led, culturally centered care. We all know how things happen when it starts to reach, national, federal, state level work. And we want to make sure that community and culture stays at the root and the center of Black doula work. So on April 11th, we're leading a national call to action and a press conference to highlight the 7 core demands. We're here from doulas across the globe. We'll hear from fathers and other legislators and national leaders who are doing this work with us. So the future is ancestral. Let's reclaim it together. Visit blackdouladay.com to submit any events that you're having on Black Doula Day and to see other events that are taking place and to find out how you can be involved. Next slide, please. I'm also really, really excited to share with you all about Missouri's 2nd annual Black Maternal Health Summit and the Black Maternal Health, get this, Rest and Collective Daydream Experience led by the Nat Bishop Trisha Hersey. Now, this is going to be an absolutely amazing summit because we really want to model to everyone how we have to care for ourselves as Black people, birth workers, parents, and advocates. This is a gathering that is bold, necessary, and transformative for Black birth workers, caregivers, and advocates nationwide. This summit was also founded by myself in 2023 and led by the Missouri Community Doula Council in 2024. In just 2 years, it has become Missouri's leading Black maternal health convening, a space where policy meets culture, advocacy meets healing, and rest meets resistance. When is the summit? April 16th through 17th this year. Where is the summit? Lincoln University at HBCU at the Missouri State Capitol. What's in store? Keynote from Trisha Hersey, the Nat Bishop, Shafia Monroe, the Queen Mother of U.S. Black Midwifery, and Michelle Browder, the creator of the Anarcha Lucy Bessie Monument. She will have the exhibit present. So come through for dynamic panels, cultural workshops, and a Black maternal health pep rally at the state capitol. And we just invite you. We have early bird tickets available through Friday, and free limited community tickets are still open. Don't wait. Register today. I'll put more info in the comments. I'm so excited. Let's have a great Black Maternal Health Week. Back to you, Angela.
Amen and Ashe Akumshala. Thank you so much. And mi Ashopoi. That's my mom's home language in Ondo as well. So much to look forward to with Jamal Birth Village. Thank you, thank you, thank you for all of the great work that you're doing, and especially out there in Ferguson. We appreciate you and love all the work that you're spearheading. Our next alliance partner is Mothering Justice. We have Ashley to give us a sneak peek at what they have planned. Ashley?
Hi, thank you, Angela. My name is Ashley Michelle, Director of Project Management at Mothering Justice, which is a multi-state advocacy organization dedicated to empowering mothers of color through policy change and community engagement. Mothering Justice has partnered with the ARIA Foundation to present In Her Honor. In Her Honor is a transformative art initiative that pays tribute to women of color who have lost their lives due to maternal health complications. The ARIA Foundation was established in 2019 after the tragic and preventable loss of Shamani Gibson due to a birth-related pulmonary embolism. The foundation seeks to support individuals, families, and communities who have experienced the devastating aftershock associated with maternal and infant morbidity and mortality. Omari, the creator of these portraits, is an acclaimed artist known for his socially impactful work. He is also the subject of the critically acclaimed documentary Aftershock, which chronicles his journey after experiencing his partner Shamani's loss due to maternal mortality. Next slide. In Her Honor, the project seeks to honor these women's legacies through a series of commissioned portraits, amplifying the awareness of maternal health disparities, particularly in Black communities. We will be hosting the portraits outside of members of the offices of the Congressional Mamas Caucus, as well as Congressional Dads Caucus, until the end of Black Maternal Health Week. We will then follow up by hosting the portraits at a gallery in DC through Postpartum Awareness Week and a final hosting of the portraits during CBC Week. We are currently actively looking for partners and sponsors for this project. If you're interested in sponsoring a portrait or partnering on the opening or closing event, or if you are in the DC area and would like to attend the events, please email me at ashley@motheringjustice.org. Also, for those located in Michigan, we will also be having a host of other events that you can participate in, and you can find those on motheringjustice.org. Thank you so much, Angela, and back to you.
Thank you so much, Ashley, and to the wonderful work that you all are doing and have been doing for a long time in Michigan and even nationally at Mothering Justice. Thank you for sharing you all's activities for Black Maternal Health Week 2025. And next, we have Kai Blue from Kaluntu Reproductive Justice Center. Kai, it's your turn.
All right, I'm ready. Good afternoon, everybody. I love this energy. Thank y'all for being on this call today. My name is Kai Blue. I use they, them pronouns. I am the founder and executive director of Kaluntu Reproductive Justice Center in Atlanta, Georgia. We're an organization that centers intersectional experiences of Black families who have multiple marginalized identities. This year for Black Maternal Health Week, we have a workshop called Redefining Family Abolition for the Current Time. So the past year, myself and my team have been working on a lit review, 50-page lit review about redefining family, about the nuclear family structure, Black and queer and disabled ways of building family and building community, a lot of the things we've been talking about on this call today, and how those things can lead us into this next moment. So we invite y'all to check out that lit review, but we are having a workshop during Black Maternal Health Week on Tuesday, April 15th. From 4 to 6 p.m. Eastern. There is a suggested contribution, but no one is turned away for lack of funds because this is crucial information. We need to talk about this. We need to talk about how to support each other outside of the nuclear family structure. So I will drop the link in the chat, but we were going to be talking about what is family abolition, what is the nuclear family structure, and some other different types of ways of building families. And lastly, we're going to be dreaming and imagining what a world could look like if we decenter the nuclear family structure. Thank y'all for your time and attention, and I will turn it back to you, Angela.
Thank you. And thank you so much, Kai, for all of the wonderful work that you're doing for our communities. Thank you so much. You all, if you have been encouraged and excited by all the brilliance that's happening just with a handful of our partners in the Alliance for Black Maternal Health Week, I encourage you to get activated now. Make sure you sign up for our newsletter. Follow us on all of our social media accounts to get ready and gear up for this year's Black Maternal Health Week campaign, April 11th through 17th. Make sure you download that toolkit. That toolkit will be your guide in how you can get further engaged and be connected to this movement, right? Thank you so much to all of our Alliance partners. You're going to hear more from our Alliance partners as we kick off Black Maternal Health Week on April 11th with a dynamic virtual rally. So this is just a taste of what's to come, okay? So thank you to our Alliance partners for giving us a look into what's to come for Black Maternal Health Week 2025 in your community. Because guess what? Black maternal health is happening in your community. So get connected with those Black-led organizations now. We hope you are all excited, right? And so now I'll pass it back to Asia for you to let us know how people can get further involved.
That was really exciting. Thank you, Angela. So the Black Maternal Health Week 2025 toolkit will be released today, right after the national call. So the toolkit will contain key messaging, statistics, graphics, assets, activities to engage in and participate in advocacy actions. You will be able to access it on our website at blackmamasmatter.org/BMHW25. Please note that this toolkit will be updated on a weekly basis leading up to Black Maternal Health Week. So be sure to check back for the latest version as each week passes. Also, as a reminder, BMMA's logo, including the Black Maternal Health Week logo, are proprietary. Unauthorized usage of the logos are prohibited. The names, trademarks, service marks, and logos of BMMA appearing on this site may not be used in any advertising or publicity or otherwise to indicate BMMA sponsorship of or affiliation with any product or service without BMMA's prior express written permission. You can, however, use the official hashtags for Black Maternal Health Week, which is further described in the BMHW 25 toolkit. You can forward all general BMH 25 inquiries to bmhw@blackmamasmatter.org and media and press inquiries to press@humanimpactsolutions.com. As a courtesy, we ask that you allow 48 to 72 hours for a response as our team is working diligently to create an engaging campaign. So we just want to thank you again for joining us for today's Black Maternal Health Week 2025 National Call. Please stay connected by signing up for our e-newsletter and following us on all social media platforms. Thank you and have a great rest of your day.